I'm DerManRx, board-certified plastic surgeon. I practice in Boca Raton. If you can see, this is the address, and you can go on the website to see the things that have been taught this afternoon. I used to come here to see those shows, and I thought, oh, maybe one day I could come here and really show my show. And this is my chance to show you something that is exciting, maybe the first time that actually it appears. Who am I? I was born in Israel. I came to this country in 1973. I was a lieutenant in the Israeli army. I did general surgery in Montefiore Hospital, and then in the University of Louisville. I'm board certified since 1981 in plastic surgery, and in private practice in Boca Raton, Florida. I'm also an artist, inventor, and educator. What kind of inventor? Inventor is somebody who does something new. And what I designed is a body glue to heal faster for patients, skin rejuvenation peel that you can see on the website, a way to do facelifts that look natural, not pulled, where the ears are not being pulled downwards. I did quick recovery breast augmentation, a new process to heal very fast for breast augmentation. And I did some work in microsurgery and developed some tissue expander for facelift in the past. I designed other instruments in plastic surgery. One of my passion is being an artist. As an artist, I did some work in oils, in sculpture. These are moving sculptures, and my work in oil has appeared even in the White House, and it was there for a period of 3 years. I pay attention to the body, and I pay attention to the face, and especially the skin. And as an inventor, as a painter, I like to see that really a skin will look like a skin. A face will look natural, even if it ages. And why? As a plastic surgeon, there's no place to hide. Not for me as a surgeon and not for the patient, because everybody sees the face all the time. So today, I talk about something special, DerManRx, and you're the first one to hear about this. It is a very, very special ultimate solution for patients who have acne, rosacea, that's the red of the skin of the face, melasma, the brown pigmentation, and generally aging, dull skin. It works well on fine lines, discoloration, and the interesting thing that it works for almost all the patients. So how is it possible that it does that? Here's a patient with acne. This acne is an inflammatory infectious disease that relates to the sebaceous glands of the face, and it appears in over 50% of the population from puberty and on. So we're talking about millions of people, only in this country, but globally, of course. And rosacea is a skin disease that affects pustules on the face, and this red appearing face appears as if they are all the time angry, and they don't find solution to this, not with antibiotics, not with pills. It appears in 15% of the population. Again, millions of people in this country. Melasma. So you know that the last year, the FDA has approved 9 medications for melasma. They all are expensive and they're not working well. These are the conditions that appear, especially in Latin, but also dark skin, where we have brown patches over the skin. It could be large ones like you see here, or smaller ones, and it appears in 27% of the population. Again, millions of people. And aging skin. Why is it important? Because as we age, we're going to start to develop all these changes that we don't like, including skin cancer. So if we can do something to the skin to make it look better at a younger age, why do we have to wait and treat it later on with bigger procedures, more expensive, leaving scars? So we're talking about aging that appears in 85% of the population, especially in South Florida, where you see the brown pigmentation, you see fine lines, precancerous skin. This is what we want to do. But we don't want to have antibiotics. We don't want to have radiation. We don't want to have cutting. What we want is something that will work well. Here's an example of a 37-year-old patient who's suffering from acne. Look at the side picture that shows those pustules. And at times, this patient is not leaving the house when they're so bad. Or look at the appearance of the acne in here. He tried everything, including antibiotics, and it wouldn't work for him. Look at the improvement to the acne. Just what is that with? A formula. That's the DerManRx that I'm going to talk to you in the next few minutes. So look what the acne gets better by using of DerManRx. No more pustules, no more breakouts, or maybe some small ones, but never like before.
Before I discovered the Derman procedure, I had a severe case of
Excuse me, can you put this?
rosacea. However, once I had the Derman procedure, forthcoming, that all changed. I was capable of going
I
out
apologize.
and again,
The sound is...
my face in public as I wanted to.
What I wanted to tell you that this guy was saying, can you do something with the sound? The speaker. Yeah. I think it's worthwhile taking it. The girls would find it in the back. I'll take a little break and tell you that patients who have acne, they have tried to use everything that you hear from the radio, on the radio, on TV, various things that they send you home that they will, you pay for the shipping and they'll send you free, but with the problem with many of these treatments that the acne comes back and gets worse when you stop it. So what we want to do is have a formula of a skin treatment that you put on the skin for a short time, and the acne will actually diminish and get better. The condition of the skin will get better and better. These patients, we're talking about age of 13 and higher, they suffer from these severe acne. Okay, you on?
It should be.
Is it on?
It should be.
The next, I'm going to go to the next one. You'll catch it on? Try to make sure. Okay. Now, look at this patient. This patient was suffering from severe acne to the point that he went through a course of Accutane. Have you heard of Accutane? Accutane, severe medication. It's worse than antibiotics. Mentally, these patients are suffering a lot. In addition to body secretions that are diminished, they find no rest until they stop this Accutane. And here, by one treatment, this patient had with a DerManRx, his skin started getting much better. Look at the before of his acne, the breakouts, and look how he appears afterwards. It's a normal skin. This patient doesn't need to use any cover-up, doesn't need to miss work, and he's happy again in his life. He can date, he can do things that he wanted to do. Darker skin this patient suffers from acne and melasma, combination of which kept her at home. She couldn't date, she couldn't do normal things in her life. Look at this severe melasma affecting the forehead, the mid-face. Those breakouts would be sometimes much worse than we see in the photograph. And look at the improvement that we do with the DerManRx. Look at the before and the after. Go ahead.
They were terrible. I mean, because my self-esteem was really, really affected by it. But then when I came in, that was my lucky day. Because my skin is like completely different now. And within a week, my skin was completely different. It was perfect.
So this patient had 2 treatments at 2 weeks apart. It's actually application of cream, repeated again in 2 weeks. We're going to show you another patient. Look at the improvement that she gets with her acne. This breakout will be so severe and she would actually bleed or have some pustules to her face, and that has been cleared up. Look at the before, including some brown pigmentation. Look at the after. There's no loss of pigmentation in these cases. There's actually a return of a normal skin. Look at the before and look at the after. This is a person who is working with me in the operating room technician, who had severe rosacea. That's the redness. A lot of overproduction of blood vessels underneath the skin, which causes the skin to be very red, almost again angry. And look at the improvement that she gets, and she doesn't need to cover it with makeup. Rosacea, very, very common among young women, and look at the improvement that she gets in the skin. Here's an extreme case of rosacea. A patient who is actually having almost like an angry-looking skin. No antibiotics would really solve the problem, and she was actually had to pick on her own wounds, and that didn't help her. And look at the improvement. She doesn't need to use makeup to cover it, and this time she's back to normal life. This is our recovery room nurse who is suffering from melasma, brown pigmentation that appears in many parts of the face. And I'm sure that you have seen friends of yours that have this situation. You know, the brown pigmentation appearing in parts of their body, especially the face, affecting them. Look at how severe it is. Large area, almost the entire right face. And look at the improvement. Look at the before and after.
I suffer from a severe case of melasma, like mostly all of my adult life. I came to see Dr. Mann, and I started using his product, the DerManRx, and within 2 weeks, my face was completely clear. I want to thank Dr. Mann for coming out with this treatment, because for me, it's been like a breakthrough with my life. I don't have to rely on all this heavy makeup to cover all these marks, and it's just been amazing.
So my biggest reward, I would say, in doing patients is to make them look natural. And why do I talk to you about skin diseases when I'm a board-certified plastic surgeon who does a lot of facelifts and noses and breasts and so forth? There's a reason, because it doesn't stop with just a facelift. Here, this is a patient who had a facelift but also had improvement to the surface of the skin. Look at the improvement. So it would not be enough just to finish a facelift and make the general appearance look good, but also the surface of the skin is very important. Here's a young patient who comes for rhinoplasty. So I've done her rhinoplasty, and this was done under anesthesia. She healed well. She was very happy with the results, but the brown pigmentation bothered her. Again, no makeup could cover it. And look how bad this was, and look at the clearance that is obtained by using DerManRx. So what do we do here? How do we achieve this? This is the important thing. What do we do when the skin gets worse and worse? And the brown, usually when somebody has the melasma, it only gets worse. It doesn't get better in time. When somebody has diabetes or high blood pressure, you can't tell by looking at them. But if somebody has melasma, there's no way to hide it. So look at the improvement that we see with these patients. I think it's very important that you can make patients comfortable in their appearance. So the sun damage and the aging skin, that's part of what we live here. In South Florida, this is where we see so much patients who are suffering from sun. And it brings us to the point that we have this precancerous skin. And if we treat that skin at a young age, they don't have to go through biopsies, cutting out, putting stitches, and doing some other things to make the skin look better. And usually what we do also, we add some fillers with that to make them look better when they start losing the volume to the face. Look at the improvement here on the skin. So she had sun damage, aging of the skin, with a little bit fillers. The surface of the skin would not look better unless it's being treated. And the DerManRx is a new formula that we have developed. And look at the improvement to the skin. So look at the pores They are now clear.